Hi, I'm your pharmacist, Aireen Soguilon at your service. Today, we're going to talk about patient counseling and its importance. The human and economic consequences of inappropriate medication use have been the subject of professional and public concern. Lack of sufficient knowledge about their health problems and medications is one cause of patients' non-adherence to their pharmacotherapeutic regimens. Without adequate knowledge, patients cannot be effective partners in managing their own care. Patient counseling is a key competency element of pharmaceutical care process. Given the advertising of medication in the media and easy access to medication on the web, it is important for pharmacists to provide appropriate, understandable, and relevant information to patients about their medication. The pharmacist is in a highly visible and readily available position to answer patient concerns and inquiries about their medications and alternative treatments they may read about or hear from others. Counseling may be defined as a one-to-one interaction between a pharmacist and a patient and/or caregiver. It is interactive in nature. It should include an assessment of whether or not the information was received as intended and that the patient understands how to use the information to improve the probability of positive therapeutic outcomes. The amount and type of information provided to the patient will vary based on the patient's needs and practice setting. Ideally, the pharmacist counsels patients on all new and refill prescriptions. If the pharmacist cannot counsel to this extent, it should be defined which patient types or which medications pharmacists will routinely counsel patients. This will vary depending on the pharmacy clientele and may include but not limited to confused patients and their caregivers, patients who are sight or hearing impaired or with poor literacy, patients whose profile shows a change in medications or dosing, new patients or those receiving a medication for the first time, patients receiving medication with special storage requirements, complicated directions, and significant side effects. To optimize drug therapy, a pharmacist should give information about the name and description of the drug or device, dosage form, dosage, route of administration, and duration of drug therapy, special directions and precautions, common severe side or adverse effects or interactions, and therapeutic contraindications that may be encountered, including their avoidance and the action required if they occur, techniques for self-monitoring of drug therapy, proper storage, and action to be taken in the event of a missed dose. Let us not forget to establish relationship to show interest to our patient. We have to verify patient's name and prescriber's name. Give information as to why the patient is being prescribed the medication or the medication's use, expected benefits, and action. Open the medication containers and show patients what the medication looks like or demonstrate how it is being used if permitted, how and when to take the medication, and give emphasis on how long should it be taken. Guide the patient on what to do if a dose is missed. Do not forget to inform the patient on how to store the medication. And after giving the instructions, verify the patient's knowledge and understanding. Ask the patient if they have any questions, and document the interaction if possible. A patient's complete understanding of how to use a medication is critical to successful adherence to medication therapy. An effective counseling session between patient and pharmacist ensures that the patient receives essential educational information related to the medication and provides an opportunity for the patient to ask questions and for the pharmacist to clarify all of it. So there you have it. Do not forget to conduct patient counseling.